So it's just a NGO doing surgeries, and they kind of teach you hands-on surgeries. The roller coaster of emotions that goes through in a day, you don't get a time to recover from that. One module of conversation to a whole different module of conversations. I think this is the struggling part.
Hi guys, welcome to the 5th episode of Pupcast. It's amazing how this show has helped me reconnect with so many people who've been there with me in my journey with animals. Today we have a very special guest on our show who's the head of the Worli branch of Crown Vet. He was the one who I took my first rescue to at 3 a.m. He was lovely. He really calmed me down, and I'm so glad to have him on the show. Hi Surya, welcome to the show.
Thank you for having me. Glad to be here.
Today's your off day, right? And
Yes.
we've got you here to do this. We're so sorry, but thank you for coming.
No, it's absolutely fine. I mean, I think it would be difficult to manage on a work day considering I work long hours. So I think this would be a perfect fit.
Okay, perfect. So tell me, how do you go about choosing this as your profession firstly? Like any kind of instant, something that happened in your childhood that led you to choose this as your profession?
I guess there are multiple factors to it. It's just not a single thing. Having said that, I've always loved pets. I always wanted a pet. All right, but it comes back to the same thing when you ask your mom, like, "Mom, I need a dog," and they'll be like, either it's you or the dog.
Oh,
So, having said that, but my grandparents always had pets when I was a kid, and I used to play with them quite a lot. So everybody, even in school, I used to play with pets over there. One of my relatives, he's also a vet. So one day he just decided, I was very much interested in science and biology. So he just said, why not we go to our hospital and have a look?
Yeah.
So there he took me in. I saw a couple of procedures happening. I was quite fascinated with the idea.
What kind of procedures?
So they were kind of doing some stitching for a large animal.
Okay.
All right. So I can see there is a person who's kind of giving injections, drawing blood. And there's one person who's kind of suturing the entire wound. So I was like, oh, this is interesting. The instruments are quite big. How do you guys do it? So that maybe would have been the first instinct for me to, choose, okay, this is not a bad idea. And since I like pets, it gels absolutely fine with my passion.
True.
So yeah, that's where I decided to go ahead with this career.
And where did you get your training from?
So I did my graduation in Tirupati.
Okay.
It's called Shri Venkateshwar Veterinary University. It's a huge campus. So I started my journey in 2009 and I graduated in 2014. From there on, once I decided, I was thinking whether should I do my master's in the country or should I move abroad? Because always in my head, I was like, okay, I'll move abroad. Back then, my brother was in Australia. So he was like, why don't you come here and try and pursue your master's? But at that point, I didn't really have much of a guidance what to do. Everything was just online knowledge. You go apply to a couple of universities. I gave my IELTS exam, everything. But somewhere down the line, that equation did not work out.
Okay.
So I was like, but then during my college itself, I went for a training program in UT to a center called as WES.
Sorry?
WES.
WES.
So it's World Veterinary Services International Training Center. So it's just a NGO doing surgeries, and they kind of teach you hands-on surgeries for new vets.
So you went in and you started with surgery?
Yes. So they give you, first day it's a demo where they just tell you what are the protocols here. And the next day onwards, you are one-on-one doing a surgery on a live patient, right, with the mentor standing in front of you.
Oh, so you have someone?
Yes, of course. I mean, they'll obviously not let us just go ahead and do it. But the techniques, the standard, the hygiene, everything that they followed. So it's a UK-based NGO.
Okay.
All right. The clinical director is also from Finland over there, and she was the clinical director at OT. So I could see the standards and the protocols being so strict, which can be kind of imposed on the current practices as well. So the idea of working there was something, again, I was like, okay, this is quite nice. And I love doing surgeries. For me, it's always that curiosity of what's happening inside. If there's something that I can do, I can correct it. Then that's a great deal of satisfaction. So eventually, I applied for WBS. I was like, okay, I've done this training. I've volunteered for you guys. I want to work for you. And they just called me in the next day. They were like, you seem to be like a perfect candidate because you know our protocols. We don't have to go through an orientation class. So I worked in OT for about a year. And then I got a call from Crown Vet somewhere in 15 December by Sharoy, my CEO.
Yeah.
So he was like, we are opening a new pet hospital in Bombay. Would you like to join? My clinical director was the one who pushed me. She was like, it would be a good opportunity maybe for you to learn stuff even more. Like, yes, you are training people here. That's great. You have students coming all across the globe. So I have students from UK, Australia, US, just coming here because they don't get hands-on training over there. It's not that easy. But here in India, when they are letting you do a hands-on procedure, then they kind of opt for it.
Okay.
So there are courses and through the entire year, and I've been doing surgeries like almost every day. So we practically do about, say, 15 to 16 surgeries every day. And the team, the coordination is amazing over there. So eventually to a point where I became proficient in teaching people how to do surgeries. If they do a mistake, we are right there to correct. So the protocols, the lectures, was everything pretty standard and organized. So, but yeah, when I got a call, Shiroy was the one who asked me, like, we are looking for a junior vet specifically, whose keen interest might be surgery. So I kind of took a leap of faith because the hospital wasn't built when I had come for the interview over here. I met Mr. Gaikwad, I met Shiroy, the entire faculty. My clinical director back then was Dr. Billy. So she's a UK vet and she was the head vet back then, technically clinical director. So she interviewed all the questions that she wanted to ask. Since I had a little bit of a surgery background, I think that's what made them choose me to join the first team in March. So yeah, I've been in Crown ever since. So 2016
onward
till date.
Nice.
That's what you can say.
I don't think you know this, but back in 2018, I had my first rescue.
Okay.
And I got him around 3 o'clock, and Crown Vet was the only 24/7 running clinic back then. And you dealt with him, and you were really amazing. And I must tell you that because I was really nervous. I didn't know it was. It was 3 a.m. I didn't know what to do with an injured dog, and you helped me and you really calmed me down. And now that dog is with me till date. I've adopted him. His name is Strong. So that's why I'm so glad I got to have you on this show. But tell me, what is your day like at Crown Vet? How many pets do you see?
So basically the day is, say, 9 to 7. That's the working hours.
Yeah.
And day begins with morning rounds, as I told. Having said that, I prefer finishing the entire work between 9 and 7.
Yeah.
And work-life balance is what I believe in.
True.
So that's about it.
So when I first met you, this is 2018, you were actually the night time. You were doing the night shift. How hard is that? Also, I feel like in the night, you're just with the animals.
Yeah.
I could hear like animals crying back there. And you're alone there. So how does that affect you? Or did it?
I mean, to get into this rhythm itself, I think is the initial struggle period.
Yeah.
Because staying up in the night, it's not like in regular hospitals where, the doctor takes a nap and there are people who come and tell them like, the patient's not doing well, doc, come on in.
Yeah.
Since this facility is not there in animals.
Yeah, true.
So that is something like just staying up in the night is the struggle factor initially to overcome. But trust me, it doesn't take much time. Maybe if you're drinking lots of coffee and obviously like I kind of keep reading articles, especially with the admitted cases. So so there is a set protocol for everything. There's a set treatment line for everything. All right. We have our, again, set timings for monitoring the patients, telling them, okay, you know what, you need to take a temperature every hour. You need to make sure that the heart rate is read every hour. Blood pressure, blood glucose, all these parameters are to be measured at a certain interval. All right. So when you're doing all this in multiple patients, your night just passes by.
There's enough to do. You have a
Yes.
schedule. Okay, what kind of stress is carried with the night shift, or whenever you're back home taking your work with you?
Well, I believe the stress factor, once you're doing a proper handover, once you in the morning, all right, it's just the comfort level at the back of my head that there are vets who are going to take off the patients.
Okay.
All right. So there is no stress carrying home. I don't think so.
Okay.
Because it's just the comfort level that, yes, I have an amazing team. I do believe in that.
Yes.
And if there is anything, we have an intense morning rounds. So whatever I'm doing, whatever is to be happening, we kind of discuss it out. So, it's done and dusted right there. You go home, you take your nap, okay, and come back to the shift again fresh. Because if you're not able to do that, then obviously you're coming with, stress, and you won't be able to work that efficiently.
True.
So, I mean, somewhere down the line, I don't think one should take the stress. But yes, it's not easy. As you said, you yourself came in 2018 in the night.
3.
All right, 3 o'clock, correct? So, calming them down, especially, as I said, dealing with pets is one thing, but dealing with owners is a whole different scenario. Because we understand where they come from.
Yeah.
All right. So once we stabilize the patient, I believe transparency helps. So you explain them everything, cut it down, break it down, tell them that this is what is happening currently and this is what needs to be done. I think your 80% of the job is done there.
True.
All right. The rest depends on how the patient responds to the medications.
Yeah. What has been the hardest part of your job?
Honestly, how do I put it as? So dealing with different, like types of cases in a day. So being a vet, I believe itself is not an easy profession.
Yeah.
At one hand, you are looking at a pet who might be critical, and you're like thinking about what can we do, what can be done, there's always a question that is there something else I can do for the pet? All right, you go through your treatment plan, especially. And maybe there is a case where the client has come to put his pet down. All right. So you're trying to tell them that this is the right thing because obviously the pets can't say it.
True.
So you become their voice and you're trying to explain it to the client that, this is what your pet is going through and probably what you're taking is a right decision. Versus a client waiting for me with a puppy right there and come for a happy puppy consult. So the roller coaster of emotions that goes through in a day.
Yes.
And you don't get a time to recover from that.
Yeah.
Like from one module of conversation to a whole different module of conversation. I think this is the struggling part.
True.
Because in the end, we are humans.
Yeah.
All right. While we are dealing with someone's grief, at the same time trying to make them explain, and versus and we have a slot of 20 minutes. I don't think anybody can turn those 20 minutes into a point where, okay, I've explained this, let's go and play with the puppy. That doesn't happen as efficient it's supposed to be. So yeah, I think that would be the struggling factor during the day. That's it.
How do you get yourself? So I personally don't support euthanasia, and I spoke to Dr. Preeti about it also. She was here in the last episode. What are your viewpoints on that?
Well, honestly, I think I do believe in euthanasia because one, it's a humane way. All right. Let me just start off with an example. I have a 12-year-old dog, all right, with maybe an underlying cardiac condition, does come up with a respiratory distress because the heart is not efficiently pumping blood. So there's a fluid accumulation happening in the chest.
Yeah.
So what we call it as a pulmonary edema case. In initial stages of diagnosed, yes, with the medications, you can get it better. All right. But to a point where the inflammation is way too much and the pet is in a not reversible stage, even though with the meds, then imagine the situation of that pet who is not able to breathe. There is no proper circulation. There is no oxygenation that is required. All right. And the pet is just uncomfortable. Now, as vets, we kind of pick up that point. And I just need to tell, like, your pet is currently not feeling well. And this is what it's going through. It's having trouble breathing. Now, that's obviously, no, there's a compromise of life right there. All right, the quality is compromised. And that's not what you want for your pet. A pet who's lived happily, running, jumping all his life, her life, and suddenly you see your pet from that model to this, then imagine what the pet is going through. I do understand that there is always an emotional connection with the owners and the pets, and they will like, doc, do anything that you can do to save my pet.
Yeah.
But if it were in our hands, trust me, we would. But if it goes beyond, then that's where I think we do need to pitch in. So I have a very simple logic. Like, if they're not able to move around freely, if they're not able to eat, anything that is regularly common for them, normal for them, and they're not able to do it, a terminal diagnosis for that matter.
Yeah.
All right. So all these things, when you diagnose, you know that there is a compromise of quality of life. And that's where you actually take a call and telling the clients that, this is how it's the ultimatum. As much as, there's no cure. The only thing that you can do is try and keep the pet comfortable and pain-free.
Yeah.
Correct? So you do that as well, but there does come a point where the pet does not respond to the medications any longer. So that's where you kind of tell them that, yes, it's time. It's not an easy thing to do, but yeah, it comes with the job.
Yeah. This you don't have to say, like, record or whatever what I'm saying. But I shared it with Dr. Preeti also. So this is one of my dogs.
Right.
Rescued again. He came to us when he was a fully grown dog. He was with us for 16 years. We don't actually know his age now.
Oh, okay.
So he was diagnosed with cancer back in 2020 and lockdown happened and he had this huge tumor. It was literally the size of like a mini football.
On the leg?
On the leg. I think he's come to you.
Okay.
Kalu. From Chamaks only.
Oh, yeah.
It burst.
Yeah. Right.
It burst. We did a surgery again because we didn't know his age, anesthesia. They were like, it's a risk. We don't know how long he's going to live. And he survived it for 4 years. He got it and he got it back again. The tumor started coming back in 2023 end. And now he had tumors all over his body. They were bleeding. And the doctors, one kidney gave off. Liver was functioning 40% or something, and the doctors so pet zone was close by because you guys shifted.
Yeah.
So we would take him there, and they were like, "You have to put him down."
Yeah.
And it was a really hard decision, but like there were days where he was roaming around because there's class. He would go meet all the students. He was still having his soup. He was still go on the road and try to find bones, and also I was like, how can I do that to the guy who's all over the place?
So, as I told, like, the quality of life, it is a terminal diagnosis.
Yeah.
Having said that, as long as the pet is comfortable, all right,
you
still probably might have a margin to take a call on whether you want to take this decision or not.
Yeah, because he survived literally 2 months after that.
Yeah,
and then
exactly.
Went literally like he went in peace.
Yeah. So, but imagine, like, it's not a pleasant experience even for the pets.
True.
All right. While graduation, we did study stages of death, like when there's a necrosis, and how does actually a heart stop? How does actually a brain stop working? The different modules. That doesn't just happen suddenly, correct?
As in during euthanasia.
No, even like if the pet has to pass away, when they say pass away peacefully, technically, we don't know what's happening within the pet's body.
True.
What stopped? Whether is it the heart or whether it is the brain? So you wouldn't know that, right?
Yeah, correct. But you can tell how much he's suffering, right? You can see that.
Again, it's again a gambling situation. Like you see either pets passing away because either of a shock, that's a possibility, a heart attack, that's a possibility, and a respiratory arrest. All right. Out of these three, your pain is processed in the brain. I'm going a little technical here. All right. So if the brain stops functioning, that's fine. The pain would not even reach the brain
Yeah.
and the body would not process it. That's where you can say, okay, the pet passed away peacefully, maybe because of that.
Yeah.
But for example, if it's the heart stops beating or it's the respiratory distress, practically your pet is suffocating. Suffocating to a point where suffocating to breathe, not able to breathe. Imagine.
I mean, of course you
gasping.
can tell
Yeah,
that,
yeah,
but like
yeah.
mine was wagging his tail, moving around, nose was wet. Like these are symptoms, these are signs, right, of a pet. So I'll ask you something on that actually. Can you remember like an instance where you really had found it hard to communicate the pet's problem to the parent?
So mostly at an emotional point of view, if a client is very attached, all right. I see different kinds of people every day. For example, if I see a pet with a broken nail, I see clients who get panicked, like, dog, there's something happening, this is an emergency, you'll have to do it.
Yeah.
Versus a pet has a broken leg, and it's like, dog, just put a plaster of Paris and, just put a bandage and give it a shot. He'll be fine.
Yeah.
So it all depends upon how people perceive. Having said that, yes, I face a difficulty, especially during diagnostics. All right, telling the pet parent that in Bombay it's still better, to be honest. People are much more open to the idea. But what you're doing, why you're doing it, as long as that's what I said, maintain a transparency. So if you're able to tell the client that this is what you're doing, and this is why we are doing it, and based on these values, we might be able to help your pet better. Now, when you're able to communicate this to the client, I don't think you will have any problem in terms of making them understand what are we doing about.
Yeah.
So it's as simple as that.
Yeah. Also, you deal with a lot of patients and their parents. How on an average basis, how well do you think they understand what their pets are going through?
So you need to understand that being a vet, the foremost thing is educating people.
Yes.
Spreading the awareness.
Yeah.
All right. Starting off from a simple vaccination, your deworming schedules, your tick-free treatments. All right. It's all about education. So as long as, especially with the new pet parents, when they come in, they come with a list of questions. They either email it or they write it down on a piece of paper and like, doc, we need 10 more minutes. So I see that enthusiasm right now in pet parents right now.
Okay.
Especially the new pet parents. But again, then there are clients who say, doc, we have had dogs all our lives.
Yeah.
So, we know what's happening. Do what's right. But at the same time, just keep it to the minimal because we will deal with this.
Okay.
All right. So, yeah, different personalities you come across every day. And I don't think it's, right now with the awareness being created and they do kind of dig deep. With the Google coming in, obviously, you give them a diagnosis. The moment they reach home, they start Googling like, okay, this is what's happening with my pet.
Yeah.
Maybe, and they come up with like, doc, why didn't we do this? So I'm like, okay, I understand where you're coming from, but let me explain again what's happening.
Yeah.
So the constant education of clients and spreading that awareness, I feel it's very, very important. So as long as people are open to the idea of listening, you're happy educating.
Okay, nice. So we had Dr. Preeti last episode, and she uses physical fitness to kind of like balance her mental stress and whatever she's going through the day. What is your?
Honestly, I think I do hit the gym.
Okay.
So it does help me out. So post my work, I hit the gym at Kim's Corner. So like working out does help me focus on what I'm doing, working on myself, making sure that I'm fit tomorrow so that I can help and, try to be much more on my toes. And you do get heavy dogs as well.
Yeah.
All right. There are times I've got St. Bernards for surgeries.
Wow.
So you really need all that physical strength. And if you don't have that, it's very difficult. So, and even for restraining pets, not everyone's cooperative. So you need that physical strength. But I feel that when you're trying to divert your focus, your energy for your own physical fitness, it kind of takes the edge off your day. And I mean, you get to focus on yourself. So yeah, that's one of the things I do. But for me, driving is therapy.
Driving is.
I love driving. So anytime I get time in the night, I take my car out. I usually go to either I catch the Worli Sea Link, Bandra Worli Sea Link, which helps. And now they have newly built that Atal Setu, right?
Yeah.
So it's a 22-kilometer stretch one way. So it's a 44-kilometer stretch up up and down. That 50-kilometer drive helps me focus, and I just listen to the music. I just drive, and it's calming.
And in the middle of that, if you get a call, emergency call, then what do you do?
So it's again, as I said, I do have a team that's amazing, and they pretty much know their game. If it's an absolute emergency, and there's nothing like they can't deal with it.
Okay.
All right. The basic stabilization of any pet that comes in as an emergency, that is something which I believe my team is capable of.
Okay, awesome.
All right. So let's say if there is, the most of the common emergencies I get in the night are something called as GDV.
Sorry?
It's called GDV.
GDV.
It goes as gastric dilatation and volvulus.
Yes.
All right. It's basically twisting of the stomach because after a heavy meal, the pet kind of gets excited, maybe gets bloated depending upon the food. The stomach rotates on its own axis.
Okay.
So there's literally a cut off blood supply. Now that's considered the top-notch emergency situations. Time is key. The quicker you come, the quicker you can relieve the entire torsion. It's a major surgery, but yes, in such situations, but you still have to stabilize the patient, correct?
Yeah.
So there's time being taken to make sure that there are fluids given, antibiotics given, pain reliefs given, making sure even the stomach's bloating, you do a procedure called trocherization to relieve that bloat. So all these things can be done by my primary team. When it comes to the main surgery, I still have a window of say 40 minutes. And I don't stay far from the hospital anyway.
Okay.
So it's quite easy to come. Yeah.
Okay.
And at night, especially in Bombay, there's no traffic. So
really?
Not really. I mean, it's not that bad as compared to the day, though.
Okay.
So grass is greener on the other side. Yeah, that's.
And what about your training now? Are you continuing to train as well?
Yes. So part of being a consulting vet also means training your juniors, because somewhere down the line you want to expand. All right, you want to create people whom you feel are capable enough, so you can take a sigh of relief in your absence.
True.
So tomorrow, if I go on leave, I know what I've trained my vets for. All right. So once I develop that confidence that they'll be able to take on this, it's easy on me. It's easy on them. So, and especially with Crown focusing on training right now. I recently went to Singapore, kind of designed the entire training protocols. I just understood, I kind of understood if it is actually applicable to the vets in India, because they have vet techs who kind of do majority of the work.
Yeah.
Versus the nurses in the country right now. It's not the same qualification. All right. Here we just see passion. If you have passion towards for working for pets, then yes, you're most likely you're more than welcome to come to the clinic and work for us, where we train them, because starting from a basic idea of taking temperatures to drawing bloods to taking X-rays. So all this, as long as you are working together as a team, the work becomes easy. It's not, again, as I said, it's not a one-man job.
Yeah.
If I start doing everything on my own, I'm sorry, I wouldn't be able to take 20 cases. I wouldn't be able to give that kind of time.
True.
So it always helps to train people. And that's what we're focusing on. Hopefully, I think it's going to kickstart off next month. So we are going to send our doctors to Singapore
Wow.
to train them even better. So hopefully when they come back, they would be, I mean, they're already great vets, but I think they will be much more refined to the level which we want, because the standard of care is what we believe and what we strive to do every day. Today, what we started off with 4 vets when initially back in Mahalakshmi when we were there.
Yeah.
I was a junior vet back then with 1 clinical director. All right. Right now we're a team of, I would say, about 80 vets around approximately, with a team of about 150, 200. All right. And we're spread across the country.
True.
So the ideology of spreading those standards, spreading that care, quality care in the country, that gives you a pride moment, right? Like,
Yes.
And trust me, back when I was working in night shifts, I used to get called from different places: Kolkata, Kanpur, all right, Chandigarh, Assam, saying that, Doc, we've just Googled you guys. We don't know what to do. Would you be able to help us out? Now, considering there's no physical examination, there's not much you can do over phone. We always prefer seeing the pet.
Yeah.
But if it is something very small, we will be like, okay, you know what, you can try this, but still consult a primary vet first thing in the morning. Having said that, you understand the necessity that the country requires right now. So I think training would help you achieve that goal.
That's true. Awesome. Any message for all the vets out there, people who are trying to pursue this as a profession?
I think it's a great and noble profession. All right. It does come with the stress factors. You need to be strong, all right, dedicated, and foremost passionate about what you do. All right. I think if someone comes with that mindset, you don't have to worry about their career. I think it goes off at a great trajectory, and the requirement currently for vets is very, very high.
Very high, yeah.
All right. I've seen how veterinary care was 8 years back versus the number of hospitals that are now coming up. The demand for vets is increasing because it was not privatized before. Like, the privatization of veterinary
Yes.
sector was very less. People used to go to NGOs. Right now we have VSPCA.
Yeah.
All right. But once people learned that, no, this is something which we can do better for our pets, and when they see the demand, obviously there are new hospitals coming. Obviously there's a increase for employment opportunities for vets.
Yeah.
So I don't think you can go wrong in choosing this as a career option. I mean, I've seen myself grow where I was working as a junior vet to my journey being a head vet.
Yeah.
I think I've come a long way and I still have a long way to go.
Yeah, I think you're doing a great job, and
Thank you.
thank you for coming on this show.
Absolute pleasure.
Thank you.